Quick tips for treating kids with a cold or flu. Cold and flu season, there are a lot of kids that will suffer with the flu and cold symptoms and have many problems with the kids and toddlers. When temperatures start turning colder and kids are inside interacting with each other in greater numbers, cold and flu season inevitably follows. And for this cold and fever, we have some of the remedies to cure as a treatment for the children. Offer plenty of the fluids as your kid will feel dehydrated because of the fever, so you must offer plenty of fluids. Keep your child hydrated to help reduce cold and flu symptoms and make them feel better. Fevers can result in dehydration. Your child may not feel as thirsty as they normally would, and they may be comfortable when drinking, so it's important to encourage them to drink plenty of fluids. Dehydration can be very serious in babies, as it will include no tears when crying, dry lips, soft spots that seem sunken in, decreased activity, and urinating less than 3 to 4 times in 24 hours. If your child is breastfed, attempt to breastfeed them more frequently than usual. For older children, sports drinks, popsicles, juice, broths, flat white soda, all are the options, and a variety of the options for taking as a fluid. Second one, clear up stuffed nasal passages. Medicated nasal sprays aren't recommended for young children. Use a cool mist humidifier in your child's room. And another option is using a saline nasal spray or drops, which makes this mucus easier to blow out or remove with a bulb syringe. This is especially helpful before feeding and bedtime. The next one is loosen the cough. If your child is over 1 year old, try giving honey for a cough instead of medication. You can give 2 to 5 milliliters of honey a few times during a day. Studies show that honey is safer and likely more effective than cough medicines for children over 1 year old. Next is promote rest. Extra rest can help your child recover faster. Your child may be very hot due to fever. Dress them comfortably and avoid heavy blankets or excessive layers that could make them feel hotter. A lukewarm bath can also help them cool off and wind down before taking a nap or going to sleep for the night. Next, know what to give and when. Adults can easily take cold and cough medications, but not for the children. Medications is not included. Just use honey, use more fluids, and take rest. If your child has a fever or symptoms of cold and is under age 2, call their pediatrician to determine first if you need to give any medication or not, or how much you need to administer. Remember that a fever is the body's way of fighting off an infection. When your child has a low grade fever, this doesn't always need to be controlled with OTC medications. Call your doctor's child's pediatrician first to find out if your child needs medication. If it's recommended that they take medication, remember to check the dosing information when using either children's or infants acetaminophen.